Hi, my name is Jill Calvin and this video is how to wrap a wound. So my horse came in and he has a wound on his lower leg. These are the things I need. I need a bowl of warm water, a sponge. This is a Biomed cleansing sponge. It's already pre-packed so I could just rip this off and start scrubbing. Otherwise, I've got the Betadine surgical scrub, which is, this is a little high, 7.5% iodine, but it's ready to go. There's also the iodine spray, which is more for cuts, for grazes and scrapes rather than the wound that he's got. Then I've got some gauze pads. These are the Band-Aid 4x4 gauze pads, and I've got a roll of thin gauze, and I've got some sticky bandages and some scissors. And this is some Tricare's triple action wound treatment. So first thing I'm going to do is I would probably hose it first just to get all the blood off to see exactly what I'm working with. Then you get the Betadine scrub. You need to scrub this for 5 minutes, but because this is a short video, I'm not going to do that. So I've got a moist sponge. Put this on the sponge and you start scrubbing. So this is where his wound is, and I'm scrubbing. I'm going to scrub for 5 minutes to make sure that that's nice and clean. And when it's clean, like it is now I'm going to get one of my 4x4 gauzes. One of them is going to be moist. So I'm going to moisten it a little bit with nice, fresh, clean water. Squeeze it so the pad is moist. I'm going to put some of the triple action care on, directly onto the square pad. I'm going to put it in a line that follows the wound. So this will go directly onto the wound. Like that. I'm also going to get my gauze and my scissors. So, and this pad, sorry, the second dry pad. So the wound is nice and clean. I'm going to put this directly on, just to hold it there. I'm going to put the dry one on top. So now we've got two. Now I'm going to get the gauze wrap. You always wrap from inside out, from back to front. You start at the side, not on the tendons. And this, I'm just going to wrap just a couple of times, and that's that. That's just going to hold that on there nicely. The next thing I do is get my quilt and my sticky, it's not vet wrap, but it's just sticky bandage wrap. So my quilt, I start again from the inside and I go from the back to the front. So I start on the side and I'm going to pull it nice and tight on the front, not too tight, but just tight enough to keep it snug, and let it relax on the back tendons. Again, pull it a little tighter on the front. And you always want it to end on the inside or the outside of the front. Never end the bandage on the back. Hi, buddy, good boy. Then I'm going to take my wrap and I'm going to start wrapping from the back to the front, and you want to leave a little white space there. Just going to wrap, oh buddy, oh. And I'm going to go tight in the front, loose along the tendons. Tight in the front, loose on the tendons. And I'm going to take it all the way down till there's about a little bit left at the bottom. And then cut that off. Nice, snug, never tight on the tendons, There's a little bit shown of the quilt at the top, a little bit shown at the bottom. And that's how you wrap a wound. Now to remove the wrapping, you would have a pair of snub-nose scissors. No. You have a pair of snub-nose scissors that you would run down the inside and cut. But because this is not really a severe wound, and because materials are expensive, I personally would unwrap from the back like this. And remove the whole thing, and then just change the dressing. And then you can reuse this quilt. I don't think you'd reuse this because it's kind of sticking to itself, but you could throw that away, and obviously you'd change the dressing. Reuse the quilt, get the new bandage. And that's how you dress a leg wound.